Good afternoon and welcome to today's COVID-19 update with the county's public health experts coming to you from the safety of their private offices. Today you will hear from the county's Director of Public Health, Dr. Vaughn Do Reynoso, and Dr. Henning Ansorg, the county's Public Health Officer. Following their updates, we will open it up to questions from the news media. As a reminder, this press conference is being interpreted in Spanish today by Moira Gallo and in American Sign Language by Julia Townsend. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSBTV 20. And with that, I will turn it over to County Public Health Director, Dr. Vaughn Do Reynoso.
Thank you, Gina. Good afternoon, everyone, and a happy Friday to all. I'd like to begin my briefing with a few comments about the data trends in Santa Barbara County. In order to move to the orange tier, we need to average fewer than 28 new cases per day. Our 7-day average of new cases by episode date is now 25. So this is really, really good news and very welcomed news. Next. The data in this slide represents Santa Barbara County's efforts. It includes anyone vaccinated in Santa Barbara County, regardless of their county of residence. It does not include information from CVS or Walgreens. We are reporting the percentage of vaccine used of what's been allocated to Santa Barbara County from the federal and the state. So of the 222,910 doses received, we have administered 117,703 first doses. We have administered 63,124 second doses. And of the single dose Johnson & Johnson, we have administered 5,956 doses. So the takeaway is that we have administered 83.9% of all the vaccines that have been allocated to our county. The remaining 16.1% of the vaccines are committed towards upcoming appointments. Next. I would like to remind everyone about who is eligible to receive a vaccine in our county. In addition to all the groups preceding, we are currently vaccinating community members 16 and above at our county community vaccination clinics. And a pause here, really needing to remind everyone that the 16 plus years of age can only be vaccinated at our community clinics using Pfizer. We are requesting parental consent, meaning that guardians and parents must accompany minors in order to be vaccinated. Next. With regards to vaccine distribution, appointments are full for the Santa Barbara clinics next week. This is really good news for us. Hospitals, pharmacies, and primary care partners will continue to serve all eligible groups, and there are availabilities among those providers. First dose vaccine appointments through the Public Health Department will become available using My Turn beginning Monday, April 12th. First dose Johnson & Johnson Clinic in Santa Maria next Friday will be available through My Turn beginning Monday. And I'd like to share with our community that on April 15th, we will begin our mobile clinics in order to bring vaccines to vulnerable communities throughout our county. Next. This is the blueprint tier. With our adjusted case rate at 6.8 as announced on Tuesday, we unfortunately are still in the red tier and have been since March 16th. But with the good news that I shared earlier, we are hoping that the downward trend continues. We do need to have our case rate below 5.9 or less than 28 new cases per day to be eligible to move towards the orange tier. Next. So do your share so that we can quickly reopen additional sectors and in greater spans. Keep doing what you're doing. We're nearly there. Please wear your mask, continue to do so, social distance, and get tested. Thank you. And with that, I'd like to introduce Dr. Ansorg, our County Health Officer.
Thank you, Director Dorinoso. Good afternoon, everyone. We are very glad to be able to report, as we just heard, that our case rates have started to decline again in Santa Barbara County. If this trend continues, we anticipate to get into the orange tier likely in 10 days. This will make it possible to allow for higher capacities at restaurants and entertainment venues. The way to get out of this pandemic is by reaching a large percentage of the population to become immune to the virus, either through vaccination or through recovery from the infection. Once about 85% of the population is immune, we will have reached a state of so-called community or herd immunity, where the virus is no longer able to spread widely. So far, about 45% of the county population over 16 has had at least one shot. We know that another 15% or so are eagerly awaiting their upcoming vaccination opportunity. We have to understand that we need to convince the people who are not yet decided on whether or not they want to be vaccinated to make up their mind and get the shot. If you had your shot, please talk to your friends and neighbors about your experience with the vaccine. Please encourage them to follow your example. Our vaccines are very safe, and adverse reactions are short-lived, quite manageable, and well worth the protection we gain through the shot. Our local monitoring project on variants of the virus that is performed by UCSB in conjunction with College Health has completed the sequencing now of 67 samples that were collected randomly in March. The results show that 42% of those were of the California variant, 30% of the United Kingdom variant, and fortunately, none of them either from the South African or Brazilian types. We are very grateful for the valuable contribution from our local partners at UCSB Virology Lab and Cottage Health. Fortunately, we do know that our vaccines work well against the locally circulating virus types. Beginning April 15th, outdoor gatherings of up to 25 people are allowed when in the red tier. The gathering size increases to 50 people in the orange and to 100 people in the yellow tiers. In addition, beginning April 15th, private events or meetings such as receptions or conferences can resume with certain modifications to reduce their risk. This includes pre-purchased tickets or defined guest lists and assigned seating. While in the red tier, outdoor gatherings are limited to 50 people and capacity increases to 200 if all guests are tested or show proof of full vaccination. Indoor activities with these private events or meetings are allowed if all guests are tested or show proof of full vaccination. The indoor capacity is limited to 100 people in the red and 200 people in the orange tier. Beginning April 15th, indoor live events or performances will be allowed again with capacity limitations depending on the tier status. Providing our community immunity increases and our hospitalizations remain stable or continue to trend downwards, We are well on our way to get beyond the tier system altogether by mid-June. To get there, please get vaccinated as soon as possible. Keep wearing your mask and do distance socially when out and about. Avoid crowds and choose your activities wisely. Please do get tested if you are not vaccinated and you did travel or attend a gathering. We are almost there. We can get to the other side of this together. Thank you for your cooperation.
Thank you so much. And now we will move on to questions from the media. First up is Blake Devine with KUIT.
Hey guys, first question for me, based on our current trends kind of going downward, should we expect an announcement to be in the orange tier next Tuesday based on the way the numbers are looking right now?
Even if the numbers qualify us next week, on Tuesday would be the first week of us meeting the metrics for orange tier, and we will need to be in the orange tier 2 weeks in order to be officially opened in the orange tier. So we would look at April 20th, that Tuesday.
That makes sense. Next week, you said the appointments are full for the Santa Barbara clinics. Do you have an estimate of how many appointments are filled up, either per day or just in total?
I don't have it off of my top of my head, but I'm estimating it to be around 9,000. We can certainly get you the exact number after the conference.
That makes sense. Thank you. I just want to ask, going back to what Dr. Ansorg said about 45% of the county's population over 16 has had at least one shot. Is it 85% to reach herd immunity? And based on your estimates, when do you think we could reach that number if we continue to get vaccinated at the rate we're getting vaccinated right now?
Well, our vaccination rate is increasing quite drastically. So now the 85% doesn't mean that it means 85% need to be immune against the virus, either by vaccination or by having recovered from the natural infection. So we are hoping to get 75% of our population vaccinated just to be on the safe side. I think by end of April, we will most likely be at the 60% level. However, that's where we need to convince our friends and neighbors to dare, to go and get a vaccine, because there's a bunch of people who are on the fence about this, who are not completely opposed to it, but just haven't made up their mind yet. So we need to encourage them to get there so that we reach our herd immunity level.
Makes sense. Last question for me. On April 15th, the mobile clinics will begin for vulnerable communities. Could you guys just describe a little more about that, how they'll work, what people should be expecting?
Sure. So we have sent out outreach information to our partners, and including the ag sector, including churches, including housing developments. What we are anticipating is on April 15th to initiate these clinics that we have already been scheduled, and we have a team. Each team has anywhere from 5 to 7 people, and we will be on site at that particular location that's been scheduled and vaccinating up to 200 people in that setting. And so we have 3 teams based out of Santa Maria Healthcare Center, and we have 1 team based out of our Lompoc Healthcare Center and another team based out of our Santa Barbara Health Center. And we have 2 outreach staff who are communicating with various groups throughout our county to schedule these mobile clinics.
And it'll be 200 people per day per clinic?
100 to 200. We have the capacity to do 1 to 200.
Perfect. Awesome. Thank you guys so much.
Thank you, Blake. Next up, we're going to Tom Bolton with NewsHawk.
Thank you very much. I had a couple questions today. Elaborating on the declining case rates. You did report a pretty large number of cases today, with the footnote that about half of those were from January and just delayed numbers. But even without that, the number was big. And I guess I'm wondering, in that context, what does that mean? Was that just an aberration? And I'm also, again, in that same context, wondering what your expectation is in terms of any impacts from Easter and spring break.
Great questions, Tom. Today's cases do include approximately 65 cases from around January 2021, which were backlogged, and now we're reporting it, and it is due to a reconciliation at the state level. Since the 65 cases are from January, I do not believe that it will have an impact on our adjusted case rate assignment next Tuesday. With regards,
go ahead.
I'm sorry. With regards to cases from spring break and Easter weekend, I'm nervously awaiting those numbers, and it looks like, looking at other jurisdictions throughout our country, there is somewhat of an uptick, and so we are anticipating somewhat of an uptick.
Okay, because at the same time, you look at the currently infectious people is at a number that's lower than it's been in quite a while, which supports the idea of the trending in the right direction. But even, like I say, even without those 60-some cases, you still had reporting 50-some cases today, right, which is a bigger number.
Right.
My second question, or my next question, involves just what kind of guidance you can provide for workplaces now that people are getting vaccinated. I would use the NewsHawk as an example. We're a small group, you could almost call it a cohort of about half a dozen or 8 people. If everybody in that kind of a situation is vaccinated, do people still need to wear masks? That's the question I've been asked several times.
Well, after April 15th, that is definitely an option not to wear masks if you are a group of less than 25 people. That is definitely an option. Now, with regard to employment, Carl OSHA is regulating industries, and therefore, if it's a certain industry sector, it's wise to always check with Carl OSHA on their requirements as well.
Okay, so that guidance is going to be coming from OSHA and not from public health, and because there's lots of types of businesses, large and small, and I think a lot of people are going to be looking for guidance on what to do, especially once you hit a higher vaccination rate.
Yes, that is correct, Tom. We are anticipating more guidance coming from the CDC and CDPH in the very near future. But if it comes to employment, it will always be very important for the employer to check with Carl OSHA as well.
All righty. Thank you very much.
Thank you, Tom. Next up, we are going to Lisa Osborne with KCSB Radio.
Hi there. My question is on behalf of some UCSB students. They want to make a vaccine appointment, but the one person who asked me says they don't have proof of residency beyond their UCSB ID card. For instance, they're an international student, so they don't have a utility bill, they don't have a paycheck stub. Will they be able to get vaccinated if they make an appointment just by showing their UCSB ID card?
Absolutely. We will vaccinate those students who have an active UCSB ID.
Great. That's good to know. I'll let them know. We'll pass that along. And then to follow up a little on Tom's question, there have been 7 new cases in Isla Vista the past 2 days. How nervous does that make you coming on the heels of spring break?
I'm not the best person to ask about getting nervous around cases. I'm always anxiously anticipating the worst. And with the spring break and increase in social activities and traveling, there's always a danger of our cases trending upwards in the wrong direction. But I am encouraged that through our collaboration that we did see very minimal activities in IV during these past 2 weeks, not the typical. So that's really good news as well.
Great. Thank you. Thanks for all you're doing.
Thank you, Lisa.
And Blake, I have the information that Blake was requesting. So we have 7,530 first doses plus 1,400 second doses. So that brings it to 9,930 in our Santa Barbara clinics next week.
Thank you, Dr. Dovernoso. And next up, we are going to Madison with Santa Barbara News Press.
Hi there. I have 2 questions. First, there are some reports circulating that a few vaccination clinics in Georgia, Colorado, North Carolina, and Iowa are pausing distribution of the J&J vaccine after people had adverse reactions. Do you think this is an area of concern? And maybe how would you respond to members of the public who might be concerned after hearing this news?
To my knowledge, that is at particular sites and not across the spectrum of anybody giving J&J vaccine. We will have given 4,000 of the Johnson & Johnson vaccines this week, and we had one well-managed reaction after vaccination. The person is doing well. So it's not anticipated to be a widespread problem with the J&J vaccine.
Great, thank you. My second question kind of circles back to an earlier topic, back to the 65 backlogged cases. Could you backlogged from January?
Well, what is confusing is that, at least it's always been confusing to me, that these cases we have cases by report date and we have cases by episode date. And those are counted differently. So a report date is like when the lab reports the test result to the public health department where the person lives. And unfortunately, this particular private lab had a backlog for, I don't know for what kind of reasons, likely IT reasons, and they reported 65 test results very late yesterday. So yes, they get counted, but because those people are no longer infectious and it doesn't have any public health ramifications any longer, they are actually not counted in the episode date numbers. So that has to be taken into consideration when we talk about case rate. The case rate that will determine whether or not we progress into a less restrictive tier goes by episode date. And that is more complex than just reported test result. I hope that makes sense.
Great, thank you.
Thank you, Madison. Next up, we are going to Laura Place with Santa Maria Times.
Hi, thank you. I was hoping for a little more clarification as well about the mobile clinics. Could you clarify like how many different areas or sites, I guess, in Santa Maria, Lompoc, Santa Barbara, those clinics will be going to? as well as just how long these mobile clinics are expected to be out there in the community? Is it just kind of indefinite at this point until more people are vaccinated, or is it a program that's going to last like a few weeks or something?
Hi, Laura. Great questions. So we have quite a few clinics booked already, starting April 15th, and they are throughout the county. The teams will be serving different regions. So as I mentioned earlier, we have 3 teams based out of Santa Maria. So those 3 teams will be visiting H2A housing, will be visiting growers, will be visiting a variety of churches and other variety of places. And then we have a similar one clinic based out of Lompoc and another out of Santa Barbara. And so when I look at what's being scheduled already, it is primarily H2A housing, farm workers. Our ag commissioner will be hosting a clinic for small growers to come and get vaccinated, as well as senior housing communities. We will be there as well. With regards to how long will we host or will we be doing the mobile clinics, we will be doing it till the end of July. And if needed, we can look at extending that. But we are hoping that by the end of July, the vulnerable populations in our county will have been vaccinated, and we will still continue to have the big community vaccination clinics as well.
Okay, great. Thank you so much.
Yes.
Thank you, Laura. And next up, we are going to Fabiola Navarrete with Tu Tiempo Digital.
Yes, hello, good afternoon. Okay, my first question is about the immunity of the vaccines. I just want to know how long does the immunity of the 3 vaccines last?
Yes, that is unknown at this point because the first test results or the first study results were started last year. So people who have had the vaccine the longest have had it for a little over a year. So all of these people still have full immunity. That's a good sign. But how long it will last for, we honestly do not know at this point. We are hoping a minimum for 3 years, but it's possible that it lasts even longer.
Okay, thank you. My next question is about reinfections of COVID-19. Have you had cases of COVID-19 reinfections in Santa Barbara County, or is just these variants?
We did have reinfections with the coronavirus. However, they are extremely rare. They're very, very rare. So that's good news.
Okay, thank you. That's all. Thank you so much.
Thank you so much, Fabiola. And that actually concludes questions from the media and today's press conference. To let everyone know, the Board of Supervisors is hosting budget workshops next Monday, Wednesday, and Friday. Therefore, we do not anticipate a press conference. However, we will continue to issue public notifications and information through the website, social media, press releases to our News Corps. And of course, we have several electronic news distribution services. So if you're signed up for news, we'll continue to be issuing news all next week. You can also catch our county public health experts live with any breaking news each Thursday on KEYT in the 11 a.m. news broadcast. Otherwise, to also stay informed, the website is updated 7 days a week in English and Spanish, and you can find that at publichealthsbc.org. For any assistance with vaccine appointments, you can either find the information and links from publichealthsbc.org under vaccinations or call 211, and for assistance with vaccine appointments, select option 4. And with that, we wish everyone a safe, healthy, and happy weekend. Thank you, everyone, for joining us, and thank you to our experts and the media. Good night.